Hi everyone, this is Pancho here from Frontier Performance. A stethoscope, a doctor's questioning process, and a happy patient. So what can salespeople learn from the questioning process that doctors use? Recently, I was having a conversation with my father, who is a retired plastic surgeon, about how he finds out what a patient wants or needs regarding surgery. He would say to me that he's never sold a day in his life. When he told me the process, I believed him. So he told me that patients would often come to his surgery with a magazine of a film star and would point out that they wanted a nose like that film star. The first thing he would do is actually set the frame for the discussion. He would build rapport and ask questions. The rapport building stage was, in fact, very, very quick. In fact, probably around 30 to 40 seconds. He would set the expectations or frame up by asking questions. Then this in itself created more rapport with the client as they would start to talk to him about their needs and desires. They felt heard. He was very patient, and this calmness also built trust in the patient. Please note that the absence of doing a feature dump at the start of a session or telling them why you're so good. In fact, he didn't even talk about his results or expertise till the end of the consultation. He would often say why they wanted a nose like that. How long have they been thinking about this? Why they actually wanted to change. At no point in the discussion did he say, I've done this, I've done that, look how great I am. This close was very simple. The close was very simple. He actually said, he just asked them when they wanted to do it. If they said yes, he would tell them the price and confirm if it was okay with them. Then he would ask them how they were going to pay for it. Then he gave them some times that was available for him and confirm if it worked for them. The last step was for them to get the paperwork done, and he had his receptionist organize it with them. At no stage was he begging for the job. Doing a feature dump, no pressure was applied to the patient to make a decision. It was all up to them. This is often called a doctor's bedside manner. Salespeople can learn a lot from following this type of process a doctor uses to build rapport, qualify, to identify the need of the client without sounding desperate or salesy. One of the most interesting things he said to me is when he did the rounds at the hospital, he would observe junior doctors coming to all types of conclusions of what the patient's problem is. He said often junior doctors coming out of medical school had all this knowledge and wanted to show how smart they were. All that it did was it upset the client, upset the patient. This is what I said is a very big lesson for salespeople. And this is what he said to me. He said, it's quite easy to work out what the problem is with the patient. You just ask them. This point was lost on a lot of junior doctors, and I think lost on many, many salespeople. The last thing here is that a stethoscope, when you place it on the heart, and when you place it on certain areas of the body, you get feedback. So selling is also about helping clients. It's about serving, not your own needs, but also the serving of the client's needs.